This is Rogers TV, Durham Region. The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
Hello, everyone, and welcome to Local Update. I'm Deborah Hutchison. It was back on March 12th when we last spoke with Dr. Robert Kyle, the Durham Region Medical Officer of Health. A lot has changed since then. It is now April 2nd, 2020. Dr. Robert Kyle joins us once again, along with, this time, Dr. Pepi McTavish, who is the Associate Medical Officer of Health. Welcome to both of you, and thank you for taking the time to speak with us today.
Good afternoon.
As I said, a lot has changed since March 12th. Durham Region is now up to 150 cases. Not the Prime Minister, but the Premier of Ontario, just before we started taping, was on TV calling the situation extremely, extremely serious. How do you see this as our Medical Officer of Health, Dr. Kyle?
Yeah, well, I can start. So I would agree with your comments, Deborah, that over the last few weeks, the situation has changed. We're seeing community-wide transmission. We're seeing an ever-increasing rise in the number of cases. We're seeing outbreaks in institutions, primarily long-term care home. We're receiving reports of cases in retirement homes. We're seeing more and more hospitalization of cases. We're seeing or hearing reports of COVID-19 in healthcare workers. So a lot has changed since our last appearance. What I've said to other media outlets, and I will repeat here, is that we're on a journey. It's not a sprint. Things will get worse before they get better. And it is important for all of us to do our part with respect to so-called flattening the curve. Maybe I'll stop there and see if Pepi has anything else to add.
I would just add that although a lot has changed, a lot is still the same. So our basic hygiene measures, washing the hands for 20 seconds with soap and water, social distancing, staying home if public health or your primary care physician tells you to self-isolate for 14 days, all of that very important basic public health work remains the same.
Well, let's talk about self-isolation and physical versus social distancing. People are not staying at home. I think that's where a lot of frustration is coming from, not only from local officials, but also the public at large. We're still seeing large gatherings out on, nice days. People are going out to the waterfront. They're driving there. I've personally still seen families at playgrounds. Let's talk about, and you've said there is a difference between physical versus social distancing. Let's start with physical distancing.
So I can start. So physical distancing is keeping 2 meters or more away from another individual versus social distancing, which is not joining groups of 5 or more individuals outside of a home setting. And self-isolation means self-isolation. If you're a returning traveler, for example, and you're on mandatory self-isolation, that means you stay in your home for 14 days. It doesn't mean you go out and do your shopping or whatever. It means stay in your home for 14 days.
Okay, so we're talking about self-isolation, social versus physical distancing. Why aren't people getting the message? Would you say most people are and it's just a few that aren't? Because we're seeing these cases, I mean, and if you watch the news and the 24-hour news cycle, these cases are skyrocketing.
Yeah, so I'll start. I think the vast majority of Durham residents get the message and are adhering to either mandatory self-isolation or mandatory quarantine. But we do get complaints on an ongoing basis with respect to, for example, returning travelers. They've returned from Florida and they're still going out. So it is happening, but I have faith in Durham residents, and I believe that most are getting the message and are practicing social and physical distancing. But there are few that are not, and that's unfortunate, and we're looking at options to try and reinforce that message. Pepi, anything to add?
No, I would just add that if people are concerned about gatherings and they do want to report it, it's actually through the Durham Regional Police Services website. You just go on and there's a link on the homepage about how to report if you see gatherings in your community of greater than 5, or if you're concerned about businesses that are open that maybe shouldn't be, you can certainly submit it through the website there.
Well, let's talk about community spread, because that is one of the big differences that is now more prevalent than when we first talked. How is community spread happening?
Do you want to tackle this one, Pepi, and I'll chip in?
Sure. So well, we know community spread is happening because in the cases that we are receiving at the health department, they have no link to travel and they have no link to cases that have been positive in the community. So they're just getting it like we would out in the community. So this can be because people don't wash their hands, people get sneezed on directly, people can be healthcare workers who are in very close contact with other members of the community. So it's out there like any other cold virus that we would see during this type of season. So right now it's assumed that it's out there in our community and everyone needs to take the proper precautions.
One thing we've heard
is... What I would add, Deborah, is that transmitters may have mild illness that mimics other types of illnesses, such as the common cold. And we're learning as we go along about the behavior, if you will, of the virus. So for some individuals, they may not have any symptoms, or they may shed for a short period of time prior to becoming ill, much like other respiratory illnesses. So transmission can be occurring without people noticing them, or they may be thinking that something else is going on with them when in fact it may be COVID-19. And this is not uncommon with a variety of respiratory illnesses. And we have to remember that out in the community, we continually see outbreaks in Durham region, and most are not COVID-19. So there are other circulating viruses out there, and we just need to be aware of that as well.
So, I mean, how do you know then? I mean, someone could feel like they just have a common cold, and could it be COVID-19?
So I'll tackle that. There is a self-assessment tool that persons can access at ontario.ca/coronavirus. I think you have to put context into account. So are you a recent traveler? Have you been in close contact with a case? Are there other situational aspects that would lean towards more COVID-19? Are you a healthcare worker? Are you working in a healthcare setting where there is likely to be COVID patients, that sort of thing. So I think you have to take your situation into account and then perhaps do a self-assessment. Do you have a fever? Do you have a cough? Do you have a shortness of breath? Pepi, any other ideas or comments?
Yeah, the only thing I would say is that if people are not tested for COVID-19, we recommend from the health department that everybody with a cough, cold, runny nose, general cough and cold symptoms, they actually stay home for 14 days now. So this isn't, oh, I have the sniffles and I'm going to go out tomorrow. If you're unwell, you really need to stay home for 2 weeks and keep your illness at home with yourself so you're not spreading it within the community.
That is different than
It's different than the message on the last time on your show. Yes.
Yeah, I mean, very much so. When it comes to the community spread, unfortunately, we've had the death of a worker that worked in a grocery store, and then there's been a second case in that store. Now, another worker at a different grocery store has tested positive for COVID-19. These stores shut down, they disinfect, and then they're open the next day. So, our viewers have said to me, how are they disinfecting? What is good enough to disinfect a store? Should they be open the very next day? I just want to get your thoughts on that.
Well, I can start. So you have to strike the right balance between continuing to provide essential services, which in the case of grocery stores means allowing persons to access food to put on the table. Versus, what are the risks, and what can the store do to promote or I'm going to say mitigate the risk of community spread. So some of the stores that I have gone into have at the door promoted hygienic measures. At times have tried to limit the number of individuals at store. Have tried to control sales at the counters through physical distancing, and have had prominent signage. Clearly, if a case is linked to a particular store, I'm sure there are industry standards in place. I know there are public health standards in place with respect to environmental cleaning. So, you need to strike the right balance between those continuing to allow those stores that provide essential services to continue to operate, but at the same time try to ensure a safe environment for patrons.
Okay, I'm gonna have to stop you there, Dr. Kyle. We have to go to a quick break. We'll continue more of our conversation with Dr. Robert Kyle and Dr. Pepi McTavish after this.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
I'm looking for David Rappaport.
Why are you wasting your time on him?
I might be all he's got.
It was his obsession to play the song.
Why did you do it?
I'm not sure you'd understand.
Edison says he's months away from lighting up the world.
Automation, transportation, communication. The man that controls that current controls that future.
Welcome back to Local Update. I'm Deborah Hutchison. We are in conversation with Dr. Robert Kyle. He is Durham Region's Medical Officer of Health, and Dr. Pepi McTavish, Associate Medical Officer of Health for the region. Once again, thanks to both of you for spending time with us today. We were talking about disinfection of stores after hearing that an employee had tested positive for COVID-19 before the break. But Dr. McTavish, I want to throw this over to you. There's been also a lot of talk about when you are going grocery shopping, of wiping down everything that comes into your house, of throwing out the paper bags and the plastic bags. Is that overkill, or at this point, is this something we should all be doing? That is, if you can find the Lysol wipes.
So it's a good, important question. Before talking about what we can do at the grocery store or when we get home, I think it's important to talk about who should not be going to get groceries.
Okay.
So certainly people who are in self-isolation, so people who have returned from travel internationally, so returning travelers from Florida, from the United States, should not be going to get groceries at this time. So they should be having grocery delivery services, which I understand are difficult to get. So friends, neighbors need to help out and drop off groceries. Also, people who are over 70 and immune compromised should not be going to get groceries at this time. So for the rest of us who are out getting groceries, certainly there are things we need to do to be smart and safe. So the first thing to do would be, if you're going grocery shopping, know what you need. So plan ahead, right? Spend as little time as possible in the grocery store. And you certainly want to stock up on perishables. So you don't need to stockpile. That's never a great idea. The grocery stores are an essential service. They will continue to run. But certainly if you need to be on home self-isolation for 2 weeks, you need to have enough food to get you through that. So stock up on 2 weeks, not more. Certainly when you get to the grocery store, you can use a disinfectant wipe, and you can actually use it on the handle of the cart if you'd like. Do your regular grocery shop. As Dr. Kyle mentioned, many grocery stores are doing a great deal of work with heightened cleaning, social distancing. There's lots of space for physical distancing at the cash. Do your regular grocery shop. As soon as you get home, wash your hands, put the groceries down, unload the groceries. Once they're away, wash your hands again, and then you can disinfect the surface of where the grocery bags would have been. Always, of course, washing soap and water 20 seconds. Anything more than that is a little bit much. I understand that people can be quite anxious about shopping, and if that is the case, you can wipe surfaces down, but we know that COVID-19 can live on surfaces for up to 24 hours, certain surfaces, but there's no evidence that we know of yet that the living on the plastic actually translate into human disease. So if you're extremely anxious about shopping, certainly people can assist you with your shopping, but as long as you use diligent hand hygiene, not touching your face while you're out grocery shopping, washing your hands when you get home, and always washing your hands before you eat, those should be good enough to keep you and your family safe.
What about washing fruits and vegetables in soapy water? We've heard that a lot too.
Yeah, so that actually is a great question, and that's not recommended. That can actually cause gastrointestinal distress for certain people. The recommendation is to wash just with regular cold water, lukewarm water for 20 seconds for your produce.
So why can that cause gastrointestinal upset with the soap?
That's a great question. So I think people are consuming soap when that happens, and that actually causes distress.
Fair enough. Yes, it would. I've also heard, though, that the virus can last on other things like hard surfaces, like the metal, cardboard, for up to 3 days. Is that correct or incorrect?
So I think the science is still evolving. The research that is out there says that yes, COVID-19 can live on surfaces, but there's no direct link to how much of the virus needs to be on that surface to infect a human. So you always want to engage in cleaning the high touch surfaces. So those are the Health Canada recommendations. So you always want to be cleaning your door handles and your faucets and children's toys. So that should be happening in your home regardless right now. And I understand that grocery stores are also, and pharmacies are doing the same, lots of cleaning of the high touch areas to keep everybody safe.
What about wearing the medical gloves?
So very good question again. We are seeing people out in the community wearing them. The trouble with gloves is that they give you a false sense of security. And you'll be wearing gloves, but people will still touch their face, their mouth, their nose, their eyes, their mucous membranes, and then the virus can still enter your body. So if you are going to wear gloves, which we wouldn't recommend, you should dispose of them in the garbage, not in the recycling, and then wash your hands with soap and water, again, not touching your face at all. But the recommendation would be to just wash your hands and then not wear the gloves. it gives people a false sense of security.
I see more and more people wearing masks as well, and there's been a lot discussed about whether that's a benefit, whether it will protect you at all. Your thoughts on that?
So there's definitely a difference between people in the community wearing masks and healthcare workers in the hospital, certainly. So there's no recommendation right now for people in the community to wear masks. If somebody is recommended to wear masks, it's because their physician or the public health department has asked them to. It's because they're sick themselves. And we want people to wear a mask so their germs, their droplets on their sneezes and coughs don't infect the rest of the community. So when they wear a mask, it keeps their own illness in. The trouble again with masks for the general population is that there's a false sense of security. So if people are wearing masks, perhaps they're not engaging in social distancing. They feel a bit safer. Also, when you wear a mask and you're not used to wearing a mask, you touch your face, you move it, people wear it sort of too high, too low, they take it off improperly, and then they can infect themselves. So people should not be wearing a mask, but if they want to in the community, they should certainly wash their hands, put the mask on properly, covering their nose and their mouth. And when they take it off, make sure it doesn't go up here, down here. They take it off properly, and then they wash their hands again and dispose of it in the garbage. But again, that wouldn't be recommended for general population out in the community.
If someone in your household does end up with COVID-19, how likely is it that the rest of the family is going to get it? And how difficult is it to truly separate yourselves if you're all living in the same house?
So that's an excellent question. It is very difficult for some families to be able to self-isolate. So if you're a single parent and you need to come home and self-isolate, that is very difficult to do from your children. So I believe right now we're looking at about 30%, and Dr. Kyle can correct me, of transmission of people who live in families who are coming home with COVID and then spreading it to the rest of their family members. But that number completely depends on how well you can self-isolate. So do you have a separate bedroom, a separate bathroom, a separate place to have your meals? Certainly, if there's more commingling, there's more risk for spreading the disease to the rest of the family.
The only thing I would add, Deborah, is there are lots of resources out there that can reinforce and help describe what Dr. McTavish has already commented on with respect to self-isolation and so forth. And so, for example, if your audience goes to durham.ca/novel coronavirus, if they're hearing too much this afternoon and they're having difficulty digesting all of this, there are excellent handouts and other resources from credible sources that they can turn to.
I want to switch gears now, Dr. Kyle, and I want to direct this to you. Let's talk about long-term care homes. There's a lot of concern out there. It is breaking our hearts, and it is making headlines today as we tape this April 2nd, 2020. More and more long-term care homes are coming down with cases of COVID-19, and it is rampantly spreading amongst the population. Hillsdale and Oshawa here in Durham region was one of the first ones that we heard, but we've had, 2 deaths now from that facility, relatively fewer than what we're hearing in other places, yes?
If you go to our website and look at status of cases in Durham region, I believe there have been 2 deaths reported to us that we have noted on our website as of yesterday. But you're quite right. There has been a COVID-19 outbreak at Hillsdale Terraces. I think I mentioned this, or Jason and I mentioned this at the last program. Seniors in particular, particularly if they have chronic diseases, are at the greatest risk for complications, and those complications include pneumonia and, unfortunately, death. I think our website has reported out 6 deaths so far. I stand to be corrected as of yesterday. Of course, our hearts go out to the family. Any death, particularly if it's premature, is certainly a terrible outcome. And a lot of additional measures have been put in place with respect to controlling outbreaks in long-term care homes. But yes, it's a challenge to control these types of outbreaks. And unfortunately, as community transmission occurs, and despite our best efforts to control outbreaks, unfortunately, we're going to see more in long-term care homes and retirement homes over the next little while.
Dr. Kyle, you were on the front lines of SARS back in 2000, and I guess it was 2003 now. Compare the two and the differences.
Well, SARS was not spread to the same degree as COVID-19. It affected certain groups of individuals, and it seemed as if transmission occurred largely in acute care settings. And so there was a smaller footprint, less disease, and our ability to respond was in some ways lessened because of the footprint in the community. Post-SARS, of course, we've seen the creation of Public Health Ontario, Public Health Agency of Canada, lots of institutions, and these have really been helpful with respect to responding to COVID-19. But certainly this is far more extensive and involving far more players in terms of the response than certainly SARS was in 2003 or pandemic influenza was in 2009.
How or what's it going to take to flatten this curve? How many more cases? When we look at this graphs that they give us, I mean, we're going up exponentially.
Yeah, so we're in a journey, not a sprint. It's going to take several weeks for us to see a flattening and hopefully a reduction in the curve. Everybody has to do their part. We've seen extraordinary emergency orders with respect to school closures, childcare center closures, restricting of gatherings, et cetera, et cetera. But we all have our part to play, particularly at the household level with respect to, in particular, if you have been told to self-isolate and or self-monitor while you're under a quarantine. And every effort to control the spread of disease is what it's going to take to flatten that curve and to reduce the demand on acute care system.
I'm going to have to stop you both there. We are out of time. Thank you so much for joining us. Our thanks to Dr. Robert Kyle and Dr. Pepi McTavish, and thanks to you for watching.
Call the Rogers TV viewer response line, email us, or